Okay, and now I want to just introduce, because we'll be talking about this set of subcortical nuclei in some detail when we talk about, for example, dopamine networks in the brain. But there's a whole set of nuclei that are located subcortically in the brain um, that are actually named kind of frustratingly because they were actually named by neurologists who studied people who had disorders of movement. These are what we call dyskinesias, disorders of movement. And there's a particular one that really ended up attaching this name to this set of interconnected subcortical nuclei. And this is a disorder known as Parkinson's disease, where people develop like a kind of a resting tremor initially. And then there's like this kind of slowing of their movements. The timing of their movements gets significantly slower, what we call brady, which means slow in Latin. Kinesia, that's kinetics for movement, so there's this bradykinesia, and it can even progress to, for example, what they call akinesia. A means nothing, no movement. They get sort of frozen, kind of in place. Parkinson's disease, was first written about in the 19th century, and when they examined areas of degeneration in the brain, there was a very specific portion of the brain stem, actually, that is known as the substantia nigra. And it's one of the nuclei that's a component of a more distributed set of subcortical nuclei known as the basal ganglia. So the substantia nigra, they named it that because it means in Latin the black substance. It looks like these, like if you cut across, the brainstem, you see it looks like a set of mustaches or eyebrows or something. It's a darkening section. These are dopaminergic neurons. These are neurons that release dopamine, but they release dopamine. They send their axons out to make synaptic connections with other subcortical nuclei, and that are all sort of linked together in these very important circuits. And this collectively, this set of nuclei, is known as the basal ganglia. So because this was named such a long time ago, there wasn't like a specific convention that we call, collections of gray matter in the peripheral nervous system, as we do most of the times now, right? We call them ganglia, while we call collections or clumps of, gray matter in the central nervous system, the subcortical clumps, we call them subcortical nuclei. So really these should be called the basal nuclei, but they were named a long time ago, and that name stuck because if you have damage to your basal ganglia or dysfunction of your basal ganglia, you have sort of clear motor dysfunction. And that's something that is very apparent to other people. If you're slowing down significantly or tremoring, or there are other disorders of the basal ganglia, including a terrible disease called Huntington's disease, where people have these ballistic movements that are uncontrolled sort of movements. There are other sort of movement disorders like obsessive compulsive disorder and Tourette syndrome, for example, where it's very visible and noticeable to others because there have been significant changes in your motor behavior. So the basal ganglia include the substantia nigra, which is a brainstem nucleus whose neurons release dopamine and other portions of the basal ganglia. But these are several interconnected nuclei that are very important for motor control and movement, particularly the timing of movement. We're going to see that if you see something that, or detect something that predicts the delivery of some sort of reward, well, you're going to speed up your movement. You're going to release the brake and sort of move towards it. And other kinds of stimuli can provoke sort of the opposite, like you step on the brake, right, as opposed to pushing the accelerator. So the timing of movement is very critically dependent upon sharing your intentions, right, or responding to stimuli kind of viscerally, sort of like very directly, because of activity in the basal ganglia. And I just wanted to show you again, if we take a look at our, coronal slice of brain, remember this was taken out like this, you can sort of see the basal ganglia in this image. So for example, this is the cortex, right? The the gyri and the sulci drops below. Here's a lot of that white matter, right? And we're going to see let's see how I can see it. So right next to these two spaces, they're called the ventricles. There's a little clump of gray matter there and there. This is actually, even though it looks kind of small and kind of oval, it's actually a pretty extensive structure. It kind of goes all the way back in the brain and all the way forward. It's called the caudate nucleus, and caudate means tail. So you're only seeing a little tiny piece of it right there and there, that darkening there and that darkening there. And then you've got this piece here, that piece there. That's the outer portion of what it's called the putamen. It's a nucleus that sort of extends forward and extends back. And the putamen, that means husk, basically. And then in here, it gets much paler, right? It's not as visible. This is lighter there and lighter there. That's the putamen here. And then right there, that's called the globus pallidus, which means the pale globe. And, actually, as you go forward in the brain, as you work your way, towards, the sort of front, the caudate, and this is, deeper in here, and the putamen around the side kind of converge on the left and right here in this clump called the nucleus accumbens. And we'll be talking about that also in relationship to drug-seeking behavior and drug use disorders. So the basal ganglia, I just want you to know at this stage, is several interconnected nuclei, very important for motor control and movement. Includes the substantia nigra, which is a pretty critical dopaminergic projection, and is definitely involved in again motivated behaviors and the timing of movement.